Aedes. Monkeypox is, even the monkeys do not carry monkeypox. The monkeypox is a big mystery actually. It was first discovered in 1958, not in the jungle, but in a lab, not in Africa or Asia. It was discovered in a lab in Copenhagen, Denmark, and not among it. And it was not discovered in its natural reservoir. It was discovered in a monkey, imported monkey from Singapore, macaque monkey. And the lab was doing studies not on pox viruses, the lab was doing studies on polio viruses. So it's a mystery how polio viruses are doing study and how they have identified the monkeypox virus in monkeys in the lab, not in the jungle. And that was about it. That was 1958. For 5 decades, nothing was heard about monkeypox. Lab made it was detected and forgotten about it. And then in the 1970s, when they were eradicating smallpox, they were going to the last mile, last house to identify house to house survey any case of smallpox. 1977, 78, they eradicated smallpox. That time they identified a lot of pox cases, which they earlier thought that it can be smallpox one, but they investigated, they found it is not smallpox. It's a very mild virus, it is monkeypox. And then they I didn't try to find antibody. Very hardly in Africa, they very monkeys they could not identify antibodies. Monkeys they could not identify monkeypox. Just an accidental, like humans get accidental infection, accidental. So it the natural reservoir they found it was in small rodents, small rodents, squirrels, shrews, and other things. So small rodents in Africa, like Congo and Central Africa, Western Africa, particularly Congo. Congo, mein, there is a lot of poverty, there is child malnutrition, and these children they play with the small rodents. Sometimes they hunt, sometimes they hunt it for food, and they are exposed to the small rodent. And this 70% cases of Congo are in children, and they are already malnourished. They are dying of cholera, they are dying of here, and that cannot be predicted as it is more fatal in children because children are handling, we have very poor children. And outside Africa, last year, that was 2 years ago, 2022, there was a huge outbreak all over Europe and USA, about more than 1 lakh cases of monkeypox, clade 2B. But that was not transmitted by animal to man, it was transmitted by human to human, mostly by homosexuals. Among unsafe sex, they used to have that gay parade and other things in Europe, Spain, and other places. So 90% cases were in male homosexuals. So it is a sexually outside Africa, it is behaving like a sexually transmitted disease. So we don't have to worry of that. It's safe sex, safe behavior. We don't worry. It is not transmitting by airborne or casual contact. It's just like HIV. Initially, there were a lot of scares of HIV. People were stigmatized and other things. So monkeypox is just like spreading, and it is self-limiting. And the death rates among lakhs of cases, the death rate was just 0.2%, and most of them were co-infected with HIV. It was more common in people who have lowered immunity like HIV. So the death may be due to other reasons. So death was 0.2%. And now also I was seeing that there are two contradictory figures. As on today, even in Congo, I saw about in September, I saw the CDC site. CDC site says that in September 2024, there were 21,000 cases and 700 deaths in Congo, present strain. 2024, that gives a fatality of 3.33%. But just today morning, I saw the WHO site. It is saying 6,169 cases and 25 deaths. So much discrepancy between the WHO site and the CDC site. I was really surprised because 21,700 deaths, ये WHO बोलता है 6,169 cases and 25 deaths. That is I'm talking of Congo. That gives an infection case fatality rate of 0.4%. In Congo 0.4%. Outside तो zero हो रहा है तो monkeypox को public health emergency कैसे declare किया? And why there is so much discrepancy in the CDC data and the WHO data? Both are supposed to be good organizations. We look up to them. If there is so much difference, means problem is Congo is a very unstable country. There is a lot of poor health services, poor data, no data rather. So these are from distance they perhaps make the estimates. And then they make the models. You were talking of models. If they make, अगर CDC data से model बनाएंगे तो फिर से घबराहट फैलाएंगे. WHO data is more sobering, but WHO data ने WHO ने उसको public health emergency declare किया. So a lot of paradoxes in monkeypox.
Mhm.
Firstly, the origin, what was it doing in a lab? Are there some biological warfare going on? There are some uncomfortable questions on this also.
That is so truly mentioned, and such results were such numbers were actually shocking for me also, because both of them, as you
Anybody
mentioned,
can check the CDC site and the WHO site. Both are giving different numbers.
it is coming from you, so obviously it is correct, doctor.
I am making a public statement. In fact, I just wrote a paper on this monkeypox and I quoted the CDC data. And now today morning I saw it's a WHO data, 0.4% error. So I was really surprised what to do with this paper. So I am also confused. So I mean, we are just going without compass. We are just going the science. We have to go back to science. We have to go back to hard data. We are just shouting on the TV, just giving opinions. So we have to go back to the basics.
So my next question actually was similar, was connecting to mpox only. But before that, let's take one question from the audience about the vaccine. So there is one CP saying that there are currently two dengue vaccines which are approved in countries outside India. So they are like Dengavaxia and Qdenga. So it is unclear when those two vaccines would be approved in India. So local Indian companies are also testing the dengue candidates in Indian critical trial sites. So what views you would give on that, doctor?
Approval is simple. If the trials are going on, the approval will be after we have the trial results. After we have the trial results, even in my college, the trials are going on. So, and I have my reservations because of the problem is even nature has not been able to make a vaccine for, because nature makes a vaccine. We get infected with a virus and we develop antibodies. So because of these four strains, the nature is also getting confused. In fact, if you get an infection with a different strain, there is more chances of dengue. So when nature is having so much challenges, let us see how humans fare. So we have to wait and watch. They say no, fools
Right.
rush where angels fear to tread. So let us see.
Right. Thank you for sharing your thoughts. Now, coming back to Mpox, Kerala recently, as you also mentioned, reported its second Mpox case, making the third all over India. So, from a public health perspective, what key strategies should be prioritized to prevent further transmission in high-risk areas, especially since Mpox isn't as widely understood yet?
The mpox is after 1 month, 2 months, one case in Haryana, one case in Kerala, and these cases are not related to each other. They are then similarly one case in I think Sweden. After that cases, there are no secondary cases. So that should reassure us. Number one. Number two, if you are really concerned, you have to only identify outside Africa. It is the sex workers, high risk group, promiscuous sex, IV drug addicts, and we have got enough experience with HIV and STDs. So we have to follow the same principles of control as we do for STD control, sexually transmitted disease and HIV. Number one. Number two is like other risk is not there because the zoonotic transmission is not there outside Africa because the reservoirs are in Africa. There are different type of prairie dogs. Prairie dogs are not dogs like we have which spread rabies. Prairie dogs are small rodent type squirrels, elephants through. So these are the small exotic pets, exotic animals which they have in Africa in the jungles. So here our children are not going to the jungle and we don't have those reservoirs. So there is no chance of trying. Well, in fact, I was surprised. I was seeing the UNICEF site also. UNICEF has written that children are at higher risk of monkeypox. I was surprised here. I didn't expect this from UNICEF. They should mention they are at higher risk in Congo, not outside Congo. Because I was seeing some people saying that children are at risk, so they get the first vaccine for me.
Mhm.
Certainly not. Certainly not. In fact, monkeypox is self-limiting in a healthy person. The recovery is 100%. There are no pox mark, and there is nothing something like chicken pox. In fact, when the vaccine for smallpox was made, it was made from cowpox. Cowpox is again mild.
Mhm.
So from that cowpox lesion, Edward Jenner took that lesion fluid and injected, and then the vaccine, because cowpox was mild, and cowpox and monkeypox are on the same level as far as severity is concerned. And now we are taking a smallpox vaccine and trying to prevent monkeypox. Jenner did it the other way around. Jenner from the heavens must be smiling here. What has come to humanity? No, you are taking a much milder disease and trying to take a smallpox vaccine, which was because smallpox vaccine had a lot of side effects. But we accepted that because smallpox was a severe disease. 30% mortality, 40% mortality. So even for a say 1% side effect, we can take a chance because we are getting it is clearly it is benefit outweighs the risk. But here we have got monkeypox outside here zero mortality. Outside Africa zero mortality. Why think of a vaccine at all? In Africa also, I am very sure if they increase the standard of living of those children, they can eradicate smallpox without vaccine because the children the root cause again I said the root cause they are poor, they are hunting the rodents, they are exposed to the elements, they are getting the and they are already malnourished. So improve the nourishment, they will survive monkeypox. Improve the nutrition, they won't be hunting for rodents. And vaccine, they are trying to ship vaccines there first. Vaccine, as I said, is a good tool as a second line measure like a gun. What initially you because after some time you see vaccine what happens strain change हो जाता है फिर आपका vaccine के side effects होते हैं cost होता है logistics होता है so many things are there. So it is good to have a vaccine as a second line drug.
Yes, that is so rightly mentioned by you. And also, I think a lot of things when you mention comes into consideration to make big impact, I would say. Now, one more question would be like, with Mpox still being an unfamiliar virus to the public, so do you think public health messaging needs to be restructured? And what's the best ways to communicate risks without causing so much of panic?
Yeah, you're very right. Actually, what I'm seeing is fear. This can be, in fact, this can be consolidated. Like you club it as a sexually transmitted disease, educate the young people, educate even those who are gay, educate them to have safe sex, to use protection. So you are not only tackling monkeypox, which is very mild, you are also tackling HIV, which is very severe. Both are transmitted in a similar way. So if you can control HIV, you will control Mpox. If you control Mpox, you are controlling HIV. So you tell and behavioral change. You see, some reports from Europe in 2022, most of these gay people, 30% of them had more than 10 different partners in the previous month. So if they live a life like that, so and then they say that this high risk group should be given vaccine. Why don't you change the behavior? Teach them about safe sex. Teach them about the irresponsible because you are protecting them from Mpox, but you are not protecting these people from HIV. You are not protecting them from other STDs, isn't it? So you have to. That's what I say. One vector-borne disease at a time. You are not. You will control that vector. What about the other vector-borne disease? So if you control the root cause, if you the central pathway. So central pathway in vector-borne disease is the mosquito and the environment. So you control that. So many disease. Similarly, in the diarrheal deaths, we are still having so many thousand diarrheal deaths daily in children in spite of the rotavirus. Because rotavirus, you had only one virus, but there are so many pathogens which are causing diarrhea. So if you have clean water, all the diarrheal deaths will come down. So similarly with the sexual, now it is outside Africa, it is behaving like a sexually transmitted disease. So safe sex, responsible sex, and in Africa, better standards of living, better nutrition, better awareness of, they should be educated about the dangers from the small rodents so they don't handle them. Similarly, for Nipah also, if the workers are going, they use gloves and protective. They are not exposed to the fruit flies or fruit bats or the half-eaten fruits. That is how it is transmitted. So if you, that they also will be safe. So Nipah is there in the trees, and I am more, as I said, I am more concerned of on the streets we are having exposed to rabies every day. So nobody is raising that. I should be when 18,000 deaths are taking place. Up to date, Nipah में जब से discover हुआ 30 years में there have not been 18,000. There have been 500 deaths also from Nipah. But here we are worried about Nipah. We are not worried about rabies, where we are losing people.
So
And we have
true.
a vaccine also rabies. As I said, the vaccine is not the panacea.
Yeah. Still, even after having vaccine, there are so many deaths that
Yeah.
are happening due to the